Okay, I'm shooting this video. My name is Mitch Ziegler. I'm a professor at Spring Arbor University and a physical therapist, and have 30 years working with people who have temporomandibular joint problems, and that's what we're going to focus on today. So when people have this temporomandibular joint problem, a lot of times it has to do a lot with posture. It has to do with a lot with the environment that their jaw is in, and their body can't heal it, and then the person is constantly aggravating it on a daily basis. So what we're going to try to do is create an environment for healing. So we're going to go over like 3 or 4 principles of that, and then we'll go into some techniques. I'll show you 3 techniques that I want you to start with. So the first thing I want to do is cover something called tweakology. So this is a term I got from my mentor, one of my mentors. His name is Gary Gray. And so a tweak for me means that you're damaging your jaw. So when you bite down into something, you get a sharp pain, or you yawn really wide and you have a sharp pain, or you do any jaw movements that create sharp pains or some really intense soreness, that means you're damaging that joint. That means you're aggravating on a daily basis, or aggravating it with that movement. So the important thing is that we have to get these tweaks down. I call them tweaks. So if you're doing this many tweaks throughout the day, the object is each day we want to try to reduce the tweaks. When we decrease the tweaks, it gives it an opportunity to heal. Each tweak is like a brand new injury. So when you injure it 20 times throughout the day, it's going to create inflammation, it's going to create problems. It's just not going to allow it's not going to allow the joint and the tissues to heal. It needs that time to heal. So we want to get rid of the tweaks. So whatever you're doing that's creating tweaks, you want to try to eliminate them. So if you're eating a large steak and biting into it hurts it, well, maybe cut into smaller pieces. Or if you're yawning really wide, then just maybe put your jaw down when you're wide to support your jaw. Or just whatever activity seems to be bothering it, then you want to try to eliminate it so there's not tweaks. Okay, so the first thing, got to get your tweaks down. If you don't get the tweaks down, you won't heal. So work on that, that's really important. Second thing is when things hurt, people touch them. If someone hurts their neck, they normally go to their neck and they rub it and rotate it. So what I want you to do is don't touch your jaw. You're not allowed to poke on it, push on it, do anything to your jaw. You have to leave it alone. I'm going to show you some techniques at the end here that you can do, but otherwise do not touch your jaw. That's when something's irritated and you push on it a lot, it just makes it more irritated, okay? Another thing, the third thing you can't do is you can't do weird movements. A lot of times when people hurt something, they'll start stretching it kind of in an odd way that they haven't done, but because of the injury they try to do it. So if they try to pull your jaw or you start doing weird things to your jaw, just don't do it. Just leave the jaw alone. Don't try to stretch it. Don't do anything to it. Just let it rest. And again, the techniques I'll show you at the end I want you to start with, okay? Let's see. Another thing too, ice is good, so just take an ice cube and rub it right over the jaw. It's a small area that you have to ice it, so just take an ice cube, work it over that area, put a towel down here just to gather up all the water that's going to drip off, and that should be fine, okay? So ice, and you can do that on the top of every hour. So if this is a really acute inflamed problem that you can't sleep or you're having troubles doing your daily activities, go ahead and use that ice there to see if you can decrease it. I'll make a little comment about anti-inflammatories like Motrin, ibuprofen, is that it's just good for short periods of time. So maybe 1 day to 3 days at the very most, just to take the edge off it. If you had a lot of tweaks and it's really flared up, just take a couple days to decrease it, but it's not meant for long-term use, okay? So that's just what we've covered so far, is just creating an environment for the joint to heal. So you have to do those things for the joint to heal. For anything that's upset in your body, that's injured, you have to do that, okay? So let's get to a couple techniques I want you to start with, and then I'll shoot another video later that'll have even more techniques, but this will get you started. One of the major causes for TMJ, or one thing that aggravates TMJ, is a forward head posture like this. What it does is it actually takes the musculature, gets tight through here, and it actually compresses the joint. So the more you're in a forward head positioning, the more it actually creates joint compression. So we don't want this forward head positioning, okay? What we want is a more neutral head position over the cervical spine. So there's a technique that I use. It's very technical, so you probably want to write this down. It's called helium head, okay? And what I want you to visualize is your head is going to be full of helium, like a balloon that you fill with helium and the balloon rises up. if you fill your head with helium, I just want you to think about how that would look and how it'd feel and how you could do it with using your head to do that. Just let it rise way up towards the ceiling. What I don't want you to do is let your chin drop, put more helium in the back of your head, and just let it come up. So I'll give you an example. If I put a brick on my head, it's gonna smush me down like this, and this is real typical posture for a lot of people. Now if I put helium in my head and just focus on this only, it'll actually elongate my spine, it'll lift everything, and it'll create traction in my cervical spine, which is good, and it'll decrease the amount of compression on the joint. Okay, so that's one thing I need you to work on. You need to do that all day long. Just think helium head. So again, this is brick head, this is helium head, okay? Another thing I want you to do is I want you to do a technique that is going to stretch the jaw a little bit. So you're going to take your fingers on both sides, and the jaw is right in front of your eardrum, or in front of your ear here. So I just want you to put your fingers right in front of your ear and just cradle your mandible and just gently pull down on the jaw, which will create a traction in there, which will open up the joint space. So you're gonna create this nice traction. It needs to be pain-free. So just try to make, if there's pulling, that's fine. If it's a slight soreness, that's fine. Any sharp pains, then this is not okay. Reposition your hands. If that doesn't fix it, then just don't do this technique. But just a gentle traction on the joint. And you wanna go very slow. You don't wanna talk like I'm doing right now. You wanna relax your jaw and just gently pull the mandible in a downward direction. So it's gonna be like a 45-degree angle down from your ear, okay? And I want you to do this for about 2 minutes. And then what we want to do is we want to start to relax all the muscles afterwards. After that 2-minute pull, you're just going to cradle your hands, or you're going to cradle your mandible with your hands, and you're just going to press gently up, and you're actually taking the mandible up into the joint. And what we want to do here is to try to shut off some of the muscular knots and different inappropriate proprioceptive signals that are being sent by the muscles. So we're just going to do this really gently for about 2 minutes, or for 2 minutes, okay? It's better to do this lying down, so I want you to do it lying down. I just wanted to demonstrate it standing because it's easier. But so you're going to pull down for 2 minutes, and you're going to compress for 2 minutes. You're going to work on helium head, and you're going to create the environment for healing. So what you're not going to do is you're not going to touch it. You're going to get your tweaks down. You're not going to do any weird movements. You're going to ice your jaw down. And those will be the first steps, just to try to create this healing environment and to try to progress this problem that you're having with your TMJ. So I'll shoot another video, it'll be part 2, but start with this, and good luck.